Hello there. Let's look at ostomies today. Ostomies are surgical interventions done to create an opening, which is called a stoma, from an area inside the body to outside the body. These areas are usually the digestive and the urinary system. Ostomies can be permanent or temporary. They are permanent when an organ is taken out entirely out of the body, maybe because of trauma or disease. For example, if the whole colon, the entire large intestine, has to be removed completely, the patient will be on a permanent ileostomy. And then for the temporary ones is if a portion of the intestine, whether the large or the small intestine, is sick or damaged, it can be a colostomy or an ileostomy can be done to divert stool while we wait for that segment of the intestine to heal. When it heals, then a reversal is done and the patient is able to go back to their normal routine of passing stool through the rectum. So there are three main types of ostomies, and that is colostomy, ileostomy, and urostomy. So just from their names, you'll be able to guess what they are. A colostomy redirects stool and gas from the large intestine. The ileostomy redirects stool and gas from the ileum, which is the lower part of the small intestine. And then the urostomy redirects urine from the bladder. Maybe if the patient had a bladder cancer and all or part of the bladder has to be surgically removed, a urostomy is done. And what they do is they take the ureters and pass it through the abdominal wall through the outside of the body, so the patient can pee from the ureters. Now they have two techniques, maybe not two, but the ones I am familiar with. And the common one is they call it the ileal conduit. And what they do there is that they attach the ureters to the ileum, and then the ileum is now an opening is made on the abdominal wall. The ileum is now brought out from the inside to the outside, and the urine now comes out through the ileum. So for example, this is the ileum. They'll attach the ureters to them like this, and then urine will pass through them into the ileum and then outside of the body. So you might see them call it ileal conduit, and it is a type of urostomy. The other type is them using the ureters directly from inside to outside through the abdominal wall. So another thing I want to point out is a urostomy is not the same thing as a nephrostomy. A nephrostomy is when they put tubes directly in the kidney to outside of the body. And usually you find those nephrostomy at the back, the lower back. That's the area where the kidney is. But the urostomy, they are in front, at the right iliac fossa. That's where you find them most of the time. So having clarified that, let us move on. So what are the implications for nurses? The implication for nurses is how to take care of the bag, the ileostomy, colostomy, and urostomy bag, or pouch. They be called a pouch. So you have to keep them clean and dry. You have to empty them if they are the ones to be emptied. And then take note of I's and O's. Let's go over the pouches, the type of pouches. So we have the drainable pouch, which is something like this. As you can drain it, you can open it. It's open open like this. If it's drainable, you can open it. But if it is not drainable, this bottom side is sealed, so that when it's filled or it's 2/3 fill, you can just remove it from the patient and throw it away. But these drainable ones, when it's filled or 2/3, you just empty it and close it back. So that's what it's meant by drainable or not drainable or closed. And those ones are the drainable ones are used especially for liquid stools, and then the non-drainable ones are used for solid stools. So you see, if it's solid, you can't drain it, you just remove it and throw it away. Then there are two types of pouches. There's a two-system pouch, and there is the two pieces. There's a two pieces system and the one pieces system. And what they mean by that is that this right here, these ones I'm showing you so far are the ileostomy and colostomy pouches. They are the same. They use the same pouches for ileostomy and colostomy. For urostomy is a different bag. You see, this is a urostomy bag right here. It is closed like this. It is open, I mean. And then when you are closing it, you do this. So this is a urostomy bag, and then these ones are colostomy and ileostomy bags. Now the two-piece system, this is how it comes. This is a wafer and this is a pouch. So this fits into this like this. You just click it close. You want to open it, you open it like this. So this is a two-piece system, and then this is a one-piece system. So the wafer and the pouch are together like that. So what you do with this is you take a scissors and cut it according to the size of the stoma. You cut it round to fit into the stoma, and you take this off. There is a sticky material here that will stick on the abdomen. So the same idea is applied here. The same idea is applied here. So that's all about the systems. Then to tell the difference between whether it's a colostomy bag or, the pouches are the same. To tell the difference whether it's colostomy or ileostomy, the contents will tell you. The ileostomy is liquid, is very liquid, because its contents from the small intestine, as at that time the water has not been reabsorbed. The reabsorption takes place in the large intestine, which is the colon. So, and that is the reason why colostomy is solid, because the water has been reabsorbed into the body. So that's one difference. The product will tell you which one it is. If it is hard or formed, it's colostomy. If it is liquidy, it's ileostomy. And this is precisely why, if your patient is on ileostomy, make sure your patient is hydrated, because he's losing fluid. So keep the patient hydrated. Then another difference is that ileostomies and urostomies are usually on the right iliac fossa, while the colostomy is on the left iliac fossa. So that's another difference. So usually there's a technique they do to keep, because the urine, it can damage the skin, and the ileostomy products, which contains digestive enzymes, which can damage the skin. So what they usually do is to make it have a sprout. They make it stick out. Instead of it to be on the level of the skin, they make it stick out like this and tight, so that the urine or the liquid stool contents have direct access to the bag, and less of it touches the skin. So those are the main differences. I believe I have covered everything. Thanks for listening. Make sure to like, share, subscribe, and follow for more.